Just to start off with the obvious, if you don't know Family Action, we're quite old. We've been going since 1869. We're still based in the East End where we started off. And we work with around 45,000 disadvantaged parents and children a year. We're based throughout England. Additionally, throughout the UK, we offer grants to people in financial hardship. I'm very pleased to say that we've just got money from Lankelly Chase to carry on our grants fund for another 3 years. And we try and use our experiences of providing services to vulnerable parents and children to campaign against poverty, and we're members of the End Child Poverty campaign. So our perinatal support services sit in the context of our other services. We run a number of children's centres throughout the UK. We specialise in professional support in the home to those families the government would call troubled. It's not really our preferred term, but the families with multiple complex needs around health, disability, sometimes the toxic three, mental health, domestic abuse, and substance misuse. We work to support those families and improve their outcomes. We work in schools. We have a lot of young carers projects. We have some health-based and wellbeing projects. We're currently commissioned by the East London GP Consortia to offer a counselling service called Well Family, throughout Hackney's GP surgeries, and last but not least, the perinatal projects. What exactly is the Perinatal Support Project? It's a service for mothers who are affected or at risk of depression and other mental health problems associated with pregnancies, either in the run-up to the birth, because we know that the in utero period increasingly is an important time where stresses can have an impact on the unborn child, and also for up to a year after the birth. So that's what Family Action means by perinatal. We've been going with that project for a long time. It originally started in South London, but more recently the projects that we have are in Hackney, West Mansfield, Oxford and Swaffham. They're pilot projects that we've been able to run thanks to funding from the Big Lottery. And what's really important to these projects is that they depend on referrals from our colleagues throughout health and early years sectors, but predominantly we love to work with midwives and health visitors, because you guys are the ones that can kind of tell us about the children and mothers in need at the earliest possible stage. The referral criteria. This is really a service for women with mild to moderate mental health difficulties, experiencing depression, anxiety, social isolation in the run-up and prep to pregnancy and afterwards. Often they're very disadvantaged women who are struggling with things like poor housing, low incomes. Maybe they don't have any family connections because they're from migrant communities, or perhaps they've lost their housing amidst the recent reforms. But these are a particular group that we're aiming to work with. As many of you know, sometimes the NHS does really excellent work, but often those mother and baby units are for women at the severe end of the spectrum, or women with existing mental health difficulties who are already known to the mental health services. If you suddenly develop mild to moderate depression during pregnancy, there's not a lot out there for you at the moment, and this is what this project is designed to work with. And again, that's the period that we're working with. Exactly what is the perinatal support model? Well, it really works on the basis that people can use their life experience of parenting, depression, other social support skills that they've learnt, and that they can use those skills to peer support women who are suffering depression. And our original randomised control trial study by Guys and Thomases found that this kind of volunteer befriending can halve the rate of the onset of depression in the perinatal period. So we've developed the project progressively from there, and the basis is that we want to break down social isolation, because we think that is one of the really important distal factors in women's mild to moderate depression. So that's really what it's there for. I have to say it's not there for the really high-end cases where there are worries about things like child protection. Those women can still have our service, but we'd want to know that they were also getting support from social services, and that they'd been through the Common Assessment Framework as well. When we go and work with families, we do a risk assessment, whoever they are, even if they've referred themselves. So the outcomes for volunteers were quite good. It increased their self-esteem. But I think most importantly, it showed the improvements that we were looking for mums and babies. So we reduced depression and anxiety. We improved social support, and we improved warmth towards the baby without the invasiveness or intrusiveness, which would be more worrying. The truth is that we badly need more services for the full range of women and indeed fathers who experience mental health difficulties before and after pregnancy. We know from all the research on attachment from psychologists such as John Bowlby that depression really impacts on mother-child bonding, and that it can sometimes do a lot of damage if people don't get support in time. The good news is that with support, parents can do better for their children. They can overcome their mental health difficulties. But the truth is what the NHS can't provide for all of this. So we need some joined up health and social care, and we think our perinatal support project is a cost-effective way to respond to that need. It's not the only answer. There's lots of great projects, and I'm sure that some of you from your own local experiences will be familiar with great kind of local authority health and third sector practice about what's going on out there, and we've really got to join it all up to what's happening in the NHS. And some of you may be interested to know of a campaign called the Maternal Mental Health Alliance, and there's a huge group of us now. It's being led by a psychiatrist called Dr. Alan Gregoire from Hampshire, but a range of researchers, the Royal College of Midwives, a number of charities, ourselves, NSPCC, and we have got funding from the Comic Relief to campaign on this, because it really is the missing gap in early interventions for mum and babies. And we've got a great network of children's centres. They're a bit devastated by the cuts. We hope the Chancellor's going to see the error of his ways. But they're a great base for kind of, plugging these kind of services into and doing the kind of joined up work that we need to as early years and health and social care professionals. And particularly, we think our project's very effective in reaching vulnerable groups of women who might not otherwise come forward for an engagement with social services, because they might have fears that their children will be taken away from them by social services. And this is kind of a low-level informal intervention to get at some of these women and families. And I would argue that, it would be much better to invest in this kind of early intervention than the crisis intervention that's the trouble families. If we can get through to families in this vulnerable perinatal period, then perhaps we can stop some of the very severe difficulties that happen later.